So hello, I'm Dr. Koen Deloose. I'm the head of the Department of Vascular Surgery in AZSint Blasius Dendermonde in Belgium. And I would like to talk to you about the 48 months results of our TINTIN trial, a physician-initiated trial that we performed with the Luminor drug-coated balloon and iVolution stent. The reasoning behind this trial is actually very clear. On one side, we are living with the leaving nothing behind adagio. But I realized in daily life, in my daily practice, that leaving nothing behind remained a dream. And so that we need the more complex, the longer, the more calcified, the more occluded the vessel is, the more scaffolds we need. And I really wanted to study, especially in very complex task C and D lesions, I wanted to study if the combination of an efficient drug-coated balloon, already proven in a lot of studies and data, that the efficiency or the efficacy of a drug-coated balloon combined with an efficient scaffold, that this is offering better results in these very complex task C and D lesions. On one side, we have the Luminor that already has proven its efficacy and safety in, for instance, the FPAC trial, a randomized controlled trial, with tremendous freedom from clinical-driven TLRs, more than 90% at 3 and 4 years, and very high primary patency rates. Of course, in the FPAC randomized controlled trial, like in a lot of these ideal circumstances RCTs, we noticed a lesion length around 6 centimeters. I don't see lesions of 6 centimeters in my daily practice. On the other hand, we have also results with the iVolution scaffold, the 19-hole stent, but on the relatively short term, 1 year, 2 year follow-up. But I wanted to be sure also, we noticed in a lot of trials that when we are facing more complex lesions, that these 19-hole stents, that they have a little bit the problem of durability. So after a couple of years, 2 years and more, you see the efficacy dropping tremendously. And so I wanted to see that if we are combining the efficacy on the longer term of the FPAC trial device, the Luminor, combining with a very good scaffold, what was proven on the shorter term in the iVolution study. So combining these two, if this is also on the longer term, an efficient and safe way of treatment of complex FEMPOP lesions. So the study design is actually, of the TINTIN trial, is actually a prospective, non-randomized, single-arm, multicenter, physician-initiated trial, where we are investigating 100 patients in complex task C and D femoropopliteal lesions, and testing this combination, as we discussed, Luminor drug-coated balloon and iVolution stent. 100 patients, task C and D, and if we are looking at the patient characteristics and the lesion characteristics, you see that we are studying a real-life population. Mean lesion length in the cohort was 24 centimeters. 60% were CTOs. 28% of the patients were real CLTI patients, report 4, 5, and 6. So that's a real cohort of daily practice vascular patients, and we studied the combination of both devices in this challenging population. So I had the honor to present at LINC 23. I had the honor to present the 48-month results, so 4-year results in these complex lesions, complex patient cohort. And so the first finding we had was actually that at 48 months, 36 patients out of our 100 enrollments died already. So it's a clear sign. It was reflected in the survival curve, in the Kaplan-Meier analysis survival rate curve, in a survival rate of 61% after 4 years. So again, another signal how diseased this category of vascular patients is. 61 survival rate. If we make the sub-analysis, critical limb ischemia patients versus claudicants, we notice that at 4 years, the survival rate was 72% in the claudicants and 43% in the CLTI patients. So it means that more than half of our CLTI patients after 48 months are dead. On the other hand, I need to say that the combination of this Luminor combined with the iVolution stent is really a good combination in these challenging lesions. We reached a freedom from clinical-driven TLR at 48 months of 74.8%. If we are looking at the clinical assessment, also there, I noticed that the shift we've made during the procedure from Rutherford 5, 4, and 3 towards 2, 1, and 0, that this is still sustained up to 48 months. And the same findings were there, a sustainable result at 48 months concerning the ABI measurements. So in general, very diseased population, relatively bad survival rates expected according to the literature, but on the other hand, a very safe and efficient combination also on the longer term of this iVolution and Luminor drug-coated balloon. The take-home message, in fact, of the TINTIN trial is very clear. First point, survival rates in very diseased vascular patients are bad. In our series, 61% after 4 years. Second take-home message, if you are facing very challenging, complex tasks, C and D lesions, occlusions, heavily calcified lesions, then you need a scaffold on one side, but you also need to have durability, a drug-eluting on the other side. Right up to now, it is paclitaxel. We don't have sufficient data with other drugs, and the Luminor is a perfect example for this. And then last but not least, if you are, let's say, comparing the findings in the TINTIN trial with some other trials, and I know that it is just for educational reasons and not scientifically perfectly correct, but if you are comparing with other studies, benchmarking with other studies, like the Illuvia long lesion registry of Münster, like the Silver Pass results, both cohorts, like the global results with the Admiral drug-coated balloon of Medtronic long lesion subcohort, we notice that the combination of scaffolding and drug elution is still a perfect winner in these difficult and complex lesions. Well, of course, like I've mentioned in the beginning, we are speaking about a single arm study over here. So I would love to see a randomized study in the same complexity of lesions and patients. So a randomized study on one side, drug-coated balloon combined with a bare metal stent scaffold versus a drug-eluting stent. And I want to see which one is the safest, is the most efficient one, not only in the very short, easy, straightforward, randomized controlled trial lesions, but also in the real-world lesions.